And lack of sleep is clinically shown to cause every single chronic medical problem we have out there, stuff that you wouldn't even think about. So from
Yikes.
dementia, weight gain, high blood pressure, kidney disease, you name it, muscle loss, it's all attributed to chronic sleep deprivation. If you are chronically underslept, you gain an average of 5 to 10 pounds a year, every year. And of course, insulin resistance, and then prediabetes and all the metabolic problems that go downstream from that. So I know it's easy to say, well, you're stressed, you need to sleep more, you need to eat better. But this is really how our body is functioning. And if you do not give your body what it needs to function, you cannot expect it to be healthy and you can't expect to feel well.
Welcome to Real Women, Real Results, the podcast where we go beyond the reps and dive into what it really takes to live a stronger, healthier, and more confident life. I'm your host, Jamie Revelle, women's fitness expert and founder of W3 Body Women's Training Gyms in Chicagoland. Each week, we'll bring you real stories, expert insights, and the tools you need to create real results. Let's get into it. Hey everyone, welcome back to Real Women, Real Results. I'm Jamie, and today we are diving into a topic that so many women ask me about inside our gyms. Why does it sometimes feel like you're doing everything right, but your body still isn't responding? Why are you exhausted, stressed, gaining weight, not sleeping, or just feeling off, even when your doctor says your labs look totally normal? If that sounds familiar, you're going to love today's conversation. I'm joined by Dr. Kate Volmir, an internal medicine physician and the founder of Lifelong Health, a concierge and functional medicine practice right here in the Hinsdale area. Dr. Kate takes a whole body, root cause approach to women's health. She looks deeper than standard labs. She blends modern medicine with lifestyle and longevity science, and she is truly changing the way women experience healthcare. What I love about her approach is that it's not about quick fixes. It's about getting answers, feeling heard, and creating a plan that actually supports your energy, hormones, metabolism, and long-term health. Today, we're talking about why so many women get dismissed in traditional care, the signs your body is giving you that you should never ignore, the tests that really matter, and how strength training plays a massive role in aging well. This is going to be one of those episodes you will want to save, share, and come back to because it's full of real information that can genuinely help you feel better. So, with that all being said, let's dive in. Dr. Kate, welcome to the show. And thank you for being here.
Yeah, absolutely.
So we'll go right into what are the biggest frustrations you see when women come from traditional primary care?
So I think the biggest one is you end up seeing a provider that's not trained in menopause. So you go in and they'll tell you something that your frozen shoulder, your insomnia, that they're two separate things. You need ibuprofen, you need an antidepressant, and that this is a normal part of aging. And really, it's mostly because our traditional internal medicine and medical school curriculums did not include menopause care. I can't really tell you why, because 50% of the world's population is women. And we all go through these changes. So you should have a doctor who's trained and knowledgeable in these changes. But unfortunately, that's how it is. So you either do not get an answer, you do not get education about what's happening to your body. And of course, nobody tells you about all of the available treatment options that are out there for you to feel like yourself and to feel better. So that I would say that's probably the biggest one. The second one is people often feel very rushed. It's very, very difficult to figure out what's wrong, to educate you, to give you all of these options for treatment in a 5-minute visit. It's not realistic. So when you feel like you didn't really get to talk, to explain yourself, to be heard, that takes time. So that's one big thing too that I make sure that part of my practice is you have as much time as you need, and we have as many visits as we need to get to the root cause of the problem. And I think the third one, I think we can all relate to is when you are feeling unwell, you can't really express it. It's very difficult to say exactly what's wrong. And you're told that everything looks fine. You have a very superficial workup, just really, really basic blood tests, an exam, maybe some imaging. And if the problem isn't found on those 3 very superficial things, you're led to believe that somehow you can't trust your body, that you should be feeling okay. And that's, it's really not true. Your body knows, your body will tell you when it's not feeling well. We should listen to it, and you should, by all means, be heard and have those concerns addressed.
What symptoms are most commonly brushed off or misunderstood for women in their 30s to 60s?
So, anything that is not an easy slam dunk diagnosis. So, chest pain, we're really good at. Broken bone, you're really good at. Infection, we are really good at. But whenever someone comes in and says, I just don't feel well, I'm really tired, I don't have the energy, at this point, our healthcare system kind of falls apart. This requires a lot of talking. It requires sometimes a very extensive workup. It requires education, lifestyle interventions. It requires a lot of work. And if you have a 5-minute visit and you get to see someone once every 6 months, that's not realistic. And unfortunately, too, most of us utilize the emergency room, urgent care, the hospital when we don't feel well. These are not things that are addressed very well inside those settings. This is very much a primary care setting situation. And to really address it, you need exceptional primary care, which is kind of what's really missing in our healthcare system.
Hmm.
Some of the other ones, hormonal menopausal transitions. So people, usually women, the first thing you might notice is you just don't feel right. You can't really put your finger on it. It's not something like your back's not hurting, your head's not hurting. You just don't feel like yourself. And whenever you say that to someone who is, trained in traditional medicine, that's kind of like the worst thing you could say. How are they going to work you up? What easy way can they get you an answer? Every woman is different. We all have different symptoms. Some of us, our first sign of perimenopause is trouble sleeping. And you might think, well, it's midlife. I'm stressed. I have a new job. We have kids. But really, sleep is your body saying it's not feeling well, something's going on, and you have to address it. The second one is mood or behavior changes. So if you are a person that, everybody has anxiety, you can't get through life without stress and anxiety. It's a part of us. But if you get to a point where you can't function, you can't do what you're supposed to be doing, you can't perform at work, your brain's not working, and you're just spiraling. I mean, something is wrong. So these are symptoms that are often, I don't want to say ignored, but they're really not addressed correctly. It takes a knowledge to understand what's happening, and it takes time to review all those changes, to teach you about those changes, and of course, to implement those treatments. So,
And what would the risks be, you think, if women keep being told that everything's normal and they don't feel normal?
so if you are having symptoms of something and it's not addressed, it's not going to go away. It's only going to get worse. And if this is your body saying, hey, I don't feel well, whatever that problem is, it's only going to become much more of a problem and affect your health down the road. So any sort of opportunity we have to really prevent disease, to cure it, early intervention is the standard of care. This is what we should be doing. We should be preventing you breaking your bones, 10 years down the road. We should be preventing heart failure. We should be preventing muscle loss, sarcopenia. Loss of sleep is detrimental to your health in every way, shape, and form. So whatever your body is feeling, it's letting you know, and we should be addressing that. It's not your normal, so we should be figuring out why it's there, and we should be addressing it.
So going back to like your background, I know that you and I had talked about this when we met a while ago, but what led you from traditional internal medicine into whole body concierge care?
I personally deeply believe that with the right tools, the right education, the right training, you can take charge of your health and really influence the sort of life you are going to live. Are you going to remain independent as you age? Are you going to spend your retirement traveling, learning new hobbies, vocations, or are you going to be driving from doctor appointment to doctor appointment? It's really not genetics. It's everything is lifestyle. It's how we build resiliency for those years. And unfortunately for women, when we turn 30, those muscle cells start to kind of dwindle down. We start losing our muscle if we don't work at it. We have to invest in our health. And you can really, really, truly meaningfully affect someone's life and health by doing this in the most meaningful way. My traditional internal medicine training allows me to take care of really, really sick people in a hospital. Anything you can think of. I used to do bone marrow transplant, medical floor, post-surgical cancer, you name it. I still take care of these patients. But it's at the end of that lifespan or that disease process. And there's so much we could do to prevent that from happening to people. You shouldn't be admitted to a nursing home when you're in your early 50s, especially not for deconditioning. But this happens every day. And I've admitted young women to nursing homes over things that we could have prevented if we just started earlier, if we implemented lifestyle, we figured out what's wrong, what's not working in your body, what nutritional support you need. Do you need hormonal support? Do you need strength training? And we would have been able to really affect the outcome. And it's so hard to fix a problem once you've kind of let it go and it's taken over your life. So this is what's led me to do all of my additional training outside of internal medicine. This is why I got trained in functional medicine, lifestyle, longevity, so that it can help you, one, learn about your body, and two, understand there's so much information out there. It comes from all sources. And I love ChatGPT, but you shouldn't be Googling what's wrong with you and trying to fix yourself. Your doctor should be helping you with that. And therefore, it's my responsibility to know about all of these things that are out there that are available for you to feel better.
Yeah, and I guess I'm sure we all can appreciate that viewpoint, and trying to get you to live your best life before something happens to where you're unfortunately really negatively affected. How would you say your approach is different from a standard 10-minute doctor visit?
First, you would schedule a meet and greet with me. So that just means we get to meet. We talk about all of the things that we offer, all of the services we offer, to see if we are a good fit for each other. And then we do what's called an executive physical. So this can be, I always warn you, I say put 2 hours away of your day because we're going to talk a lot. It's a very extensive, comprehensive exam. We do blood work, which isn't just traditional surface level blood work. We do, we have a lot of technology now to really give you insight into your health and how your body is working. And depending on your goals, we'd really try to focus on that and, take one step at a time. And then once we have that, I build you what I call a health and wellness plan for the year. So we have a guideline on what we're going to work on, what your concerns are, what we medically need to address, how we're going to address that, lifestyle, medication, everything you can think of in between. And then we, of course, do teaching. So you come back and we review your labs in detail. What are we testing for? Why did we do this? What risk factors do you have that you really need to compensate for? What resiliency do you have built into your genetics? And then once you understand your body and where you are, and you have that, that data, to support you, we start working together and we implement a lot of changes. We, of course, will repeat some of that blood work in 6 months or 4 months to see where we are and really keep us on track to keeping you, not just normal, but really optimal.
Oh, so, and I've been curious to ask, what type of like advanced blood tests, like, are you guys testing for advanced diagnostics that you use that just change the game for women's health?
Sure. So there's a lot of technology out in the last 10, 20 years that's made things very, very affordable and accessible. And also, a lot of insurance companies now allow us to bill them for some of these things. So, first and foremost, we do advanced cardiac lipid profile. So, this means that when you go to get screened for cholesterol, the regular old fashioned test really doesn't tell us anything. We look for LDL, which in itself, half the people who have heart attacks have normal LDL. So, it's not very useful. But there are tests within that where we can see how big and how dense those little lipid particles are. And that's actually what correlates with things like heart attack, cardiovascular disease. So we do this type of testing. We also test for certain types of proteins you might have on your cells that affect your metabolism of those lipids. We check for oxidative stress, so how you metabolize, how much stress there is in your body, which is putting you at risk for all of these problems because a heart attack, a stroke, blood pressure, these are all honestly the same problem. It's just a different manifestation of it. We also believe in doing full hormonal workup. So you come in, we are checking everything, not just the first part of your thyroid hormone, the downstream effect, the active part of your thyroid, your full hormonal panel, because I need to know where your body is. I need to know, how you are feeling. I need to correlate that. And if we, of course, choose to do hormone replacement, then yeah, we absolutely need to know where you started to be able to compare to how you are now feeling. I also offer something called genomic testing. This is newer technology that allows us to see how efficient your enzymes are and how inefficient they are. We all metabolize things differently. So I could take a pain medication, you could take the same one. It could have no effect on me. It could make you very sick and work very, very well on you. So we have ways of testing for these small, tiny variants in these enzymes that are mostly in our liver. And this can give us insight into, well, you know what? You should really, really avoid alcohol. You really need to supplement with antioxidants if your diet doesn't have like the best diet in the world. And we can use that to say, hey, you have risk factors for this problem. And if it's really, really important for you to have cognitive health, to protect your brain, these are things we can do right now to help protect you, to help preserve your cognitive function and help keep you healthy. So, and we have this, and it's not that expensive. It used to be extremely expensive many years ago. It's available for you if you are a member of my practice as well.
That sounds really
Yeah, there's
cool.
a lot more stuff, but I don't want to
Yeah.
list off 15 panels worth of things you could technically be doing to, learn about yourself and learn about your body.
Yeah. So someone comes in and you kind of chat about what they're experiencing, and then you decide which one of these advanced tests
Yeah,
makes
so
sense for them.
we decide together. So if your goal is, I'm really afraid, I have high blood pressure, and I really want to be healthy from a cardiovascular standpoint. That's what we start with. If you have, let's say, a family history of cancer, or you're just afraid of cancer, we can do, additionally to what we're doing, we have these advanced cancer screening tests. And then we, of course, everything we order, we will talk about what we're doing, why. Does your insurance cover this usually? How much could you expect to pay if you're paying for this out of pocket? God forbid it comes back positive. What do we do? What does that even mean? So you have to be really educated on what we are doing together as a team instead of me just ordering really expensive workup. And you have to be ready to make a lifestyle change, right? This is for people who are motivated. These are people who are health conscious. These are people who are passionate about their health. Or if you're just starting and you're like, you know what? I want to do better. I want to take care of myself better. I know that I have it in me. I just need the support and the education and the training. This is for you. If you are not ready, that's okay. We start with what you are ready to do. So it could be something really small, like maybe just one little thing on your plate that resembles a vegetable, or maybe just going for a walk twice a week. Everybody has their own, they're ready at their own time, and I'm just here to support you in whatever you're willing to do.
Yeah, that's awesome. I feel like too with people who, let's say, they're just kind of frustrated because they've been either told something that's not working or told you're fine, forced. Maybe they just don't even know where to start with trying to get better, feel better. Even just having some type of diagnosis or answer through these tests would be helpful for them to hopefully get motivated at that
Yeah.
point.
I think a lot of people are just really, really frustrated. You want to feel better, you want answers. You can't get that from a traditional 5-minute visit. It's just not possible. This is like personal training or working out for a purpose. It takes hours of work, sometimes several hours a week. It takes time to build muscle. It takes time to learn how to live a healthy lifestyle and what you need to do for your body that works for you. Being able to provide these services in a concierge style primary care setting is honestly perfect because you pick up the phone and you call me directly. We are not limited in our time and our interaction. It's very, very personal, and we are able to build a relationship where I know you really well. And I say, hey, you know what? I know you're not ready for this. I'm not even going to bring it up, but we can start this because it seems like it aligns with your goals, and it's something that I could easily support you through. And then, of course, talk you through as you're doing it. And I think that when you have that support, you succeed, right? This is
Hmm.
why we, myself included, do personal training. If you want to learn how to lift weights, you need someone to help you do it correctly. So that's what primary care honestly should be too.
Yeah. It sounds really fulfilling from your standpoint, from the doctor's standpoint. If you got into that and into practicing medicine because you want to help people, it sounds like it's so hands-on with their plan.
Yeah, so this is what I call a old-fashioned traditional type of medicine. We used to be able to do this. We used to have these long visits. We used to have this relationship. A lot of things became, say, corporate or more mechanical and very efficient. And through that process of trying to take care of 4,000 people a year, we lost this. But there are options for you that, I would say it's not for everybody. It's really for people who are really passionate and really are ready to make a change in their life and need that sort of relationship. But definitely, I think for you to have the best results and the best outcome, you need the education, you need the training, you need the support. So that is what I am here to provide. And of course, I also use the support of some local partners to help get you there. So gyms, local studios, acupuncture. I mean, really anything that you might need to help you feel and look your very best.
Cool. I'm so intrigued. I'm going to pay you a visit. So, just a couple more questions.
Sure.
So if, speaking of our market here, if a woman feels off, but her labs look normal, which deeper labs do you wish that she had access to?
Whoever is taking care of you should be offering, we should never miss. So, one is called fasting insulin. This is something that's used in longevity and functional medicine, in traditional medicine as well. And it's something that can predict what ends up being metabolic syndrome, prediabetes, diabetes, and then, of course, everything else falls apart. So, this is the first marker that there is a metabolic problem going on that we should be addressing before you get sicker. The second one is doing a full thyroid panel, not just TSH. There's something called T3, which is your active thyroid. That's what's actually happening in your body and doing what it's supposed to be doing. And then there's the reverse of that, meaning that hormone was turned off by your system because of stress, because of illness, infection, so on and so forth. So having actual full thyroid panel done and evaluated in this way, that's essential. The cardiac lipid density testing, everybody should have this done. This is the standard of care that will become the standard of care in the next couple of years. Once it becomes more mainstream, insurance companies already pay for it. Cardiologists in major universities all know about it. So it's just going to become more and more. Once we learn awareness and implement these changes, this is going to become, at the standard of care. Cortisol 4-point testing. We have ways of checking your stress hormone at home with saliva or urine. It's very simple, very easy to do, and it's very, very cheap. These tests used to cost a lot of money, which was always kind of a barrier to you getting answers, but they're very cheap now. If your cortisol is peaking when you are trying to sleep, that's not good, right? That's saying your body's under extreme stress, and we have to figure out why that's happening. There are additional what we call oxidative stress testing, so metabolic testing. This falls into functional longevity medicine, which gives us insight into, what are your risk factors? What's happening in your body? How stressed out is your body? And we use this kind of like a leverage to see how you're progressing, how you are getting those numbers down, and if what we're doing with your lifestyle is actually working and helping you get to where you need to be. So these are, I would say, very, very accessible tests. These are done by local lab companies. Any sort of primary care doctor can order these. They're not difficult to access. They're not expensive. And I'll say the vast majority of them are often covered by insurance. I say often because nobody knows what your insurance company is going to pay for at the end of the day. But there's ways of checking this too before we order things if of course cost is a concern.
Yeah, of course. And I was going to ask about stress and sleep and how that shows up in labs, but you had mentioned it. It sounds like it's
So
cortisol mainly.
stress kills us in all these different ways. And lack of sleep is clinically shown to cause every single chronic medical problem we have out there, stuff that you wouldn't even think about. So, from
Yikes.
dementia, weight gain, high blood pressure, kidney disease, you name it, muscle loss, it's all attributed to chronic sleep deprivation. There's this really great PhD doctor from Harvard who did a lot of sleep studies and dedicated his whole life to sleep research. He wrote a wonderful book called Why Do We Sleep? And in his book, one of his colleagues at Harvard actually did metabolic testing based off of the loss of sleep. So they found that if you are chronically underslept, you gain an average of 5 to 10 pounds a year, every year. And of course, insulin resistance and then prediabetes and all the metabolic problems that go downstream from that. So I know it's easy to say, well, you're stressed, you need to sleep more, you need to eat better. But this is really how our body is functioning. And if you do not give your body what it needs to function, you cannot expect it to be healthy and you can't expect to feel well. So we always have to start with, what are we doing in our life that is keeping us from being optimal? What's important for you to know about why you are doing this? And of course, if we test cortisol and we see that, hey, it's super high, that's just showing you that, things need to change. We're not, it's not in our head. Something is wrong. This is one of those things that shows us that something is wrong. And we need to use that as a guide to really focus on whatever the problem is for you.
Yeah. And when it comes to muscle and strength training, why would you say like strength training is one of the keys to longevity and one of the biggest longevity tools that we have?
So, this is pretty well studied. People who are obsessed with living forever and staying young and healthy have gone into do all sorts of studies about what is the best predictor, what is the best marker. We do have things like VO2 max, which, outperformed grip strength and all these different things. And we could say, hey, if you have a high VO2 max, you're basically going to outlive everybody in your cohort. To have a high VO2 max, you need strength training with resistance training. You need a bit of cardiovascular, you need a bit of HIIT style workouts, and not just strength training where you want to have optimal muscle mass, but also, moving around between the weights. Which, if you do any sort of workout class or work with a personal trainer, by default, you're going to be doing cardiovascular and resistance implemented into that strength training as well. We know that things like farmer carries help us have strong, lean muscle. And we know that lean muscle, especially in your quads, your lower body, is directly proportional to you being able to stand up from a chair when you get older. And that is proportional to also your brain health. There's things that your muscles secrete. And they also help whenever we have things like strokes. We know that people who have a stroke, who get intense physical therapy right after the stroke, they recover the best, the fastest, and they do the best. So we have, these stem cells in our brain that get a signal from this muscle that says, hey, you need to mature, you need to fix the problem. And our body talks, our muscles talk to our brain, our whole body talks to itself. Whatever supplement we've come up with, whatever testing we've done, whatever nutritional or lifestyle thing we have tried to do to promote our longevity and health, nothing has matched exercise, whatever sort of exercise you're willing to do. Things like resistance training are great for brain health, like depression, anxiety. Yoga is great for brain health, like depression, anxiety. Strength training, obviously, for your muscles. Whatever you are willing to do, I say, I always start with, even if it is walking, if you walk 10,000 steps a day, you drop your risk of dementia by 50%, and you are just walking. So start with something. Anything you're willing to do is going to get you farther than you are right now. And then on that, so I'll just give you like a reference to, there's two studies that we did in the last 25 years or so. One of them they did in 2003. They looked at over 1,000 adults between 60 and 89. So not, I'll say young people, because young is a relative term. And they noted that people who can do a box jump or any sort of jump really, so 25 centimeters, so that's 12 inches for us. So it's a baby box jump. And if you could do a baby box jump, you could reduce your risk of being admitted to a nursing home by 80%. And then they did another study more recently with people who are considered more like athletes, so people who lift weights. And their age span was from 35 to 91 years old, so people who are very, very active. And they noted that people who are high jumpers, so same thing, 12 inches, baby box jump, they had minimal functional loss. So these are people who are going to be independent. They're not, this is what we can all hope for when we get to a certain age, if we're lucky enough to live to be 80 and 90 and maybe 100. We want to live on our own terms. We want to be independent. That is the biggest predictor too of your mortality. And I mean, everything, every quality of life aspects you can think of is related to you being mobile and you being able to stand up from a chair by yourself. So you can affect that. You have to start now if you didn't start already. But no, every time you're at the gym, you're doing a box jump, you're like, this is me staying out of the nursing home. This is me staying out of the nursing home. And yeah, and we're here to support you if you've never done one before.
Absolutely. So baby box jump, I've got that in my head.
Yeah.
I'm gonna do at least one a day. I love that. So movement, exercise in the way that it, at least initially is doable for someone is definitely a big one. What about any other like simple, realistic changes that someone can make just this week to improve their long-term health?
So there's so much that you could start with. And, we always say nutrition is the foundation of everything that we do. This is fuel for your body. I always tell people that, hey, pretend that you are a Porsche, right? If you are a Porsche, you're going to get the best premium gas into you. And as a person, the same concept applies. You need to feed yourself real food. We sometimes forget what real food looks like. There's been a lot of marketing and a lot of I'll say ads that present something that's not real food to you that confuses you. So real food is when you have lean protein, you have vegetables, stuff that came from the ground recently and looks like it, that hasn't been overly processed. And then, you have your carbs, ideally things that are low glycemic index, which just means that things that don't spike your blood sugar very high. So if you like rice, pasta, potatoes, all those wonderful things, if you stick it in the fridge and eat it the next day, it's actually much healthier for you. But of course, a little bit of potatoes here and there ain't going to kill anybody.
Hmm.
Try to find one meal a day where you look at your meal and you're like, wow, I did a good job. I fed myself correctly. I had nutrition today. Maybe breakfast wasn't so good. You were in a hurry. Dinner was chaotic, but maybe lunch, you actually had a well balanced plate. You had one meal where you knew that you fed your body, you gave it the nutrition it needed, you gave it the protein it needed. And that's like 80% of it. The rest, will come with time. And if you need help and support, there are so many groups of people out there, gyms, studios, myself. I mean, we can help you find whatever works for you. Yeah.
Yeah. And so speaking of that, where can our listeners find you if they're looking for or to even just to learn more about your concierge practice?
So if you go on my website, there's a big button that says meet and greet. That is a complimentary visit where we just sit down and talk about all of this. And figure out how we can help you, how we can support you, and whether or not we are a good fit for each other. You can also message me on any of my social media platforms for my clinic. They all go to me. So you literally will talk to me directly. So, I have like an automated response that says, hey, I'll get back to you within 24 hours. It's usually within an hour or two. And you, of course, can just pick up the phone and call the clinic. If you call my clinic, it goes directly to me. So I pick up the phone and then we could just go from there.
That's awesome. That's really, really cool. And what are those social media platforms? What are your handles?
So my Instagram is at Lifelong Health Clinic, my Facebook page as well. And then, of course, my website is www.lifelong-health.org.
All right. Well, Dr. Kate, I have one more question for you that I like
Sure.
to end every podcast with. What does being a strong woman mean to you in this phase of your life?
So for me, being a strong woman means own your health and intention, listening to your body, giving yourself the time and care that you deserve, advocating for yourself, building a lifestyle that supports longevity and true health. It means rejecting the idea that you're just getting old and you have to accept it, and instead recognizing that with the right tools, support, personalized care, you can feel your best and thrive at every age. You don't pour from an empty cup. You have to take care of yourself so that you can continue to take care of everybody else.
Absolutely. And I love what you said about being your own advocate because it's so true. And it's something I think that we all underestimate that things are just going to get figured out or someone's going to reach out to you to figure it out. Like, no, we need to keep pushing and find the answers that we deserve.
I think all of us, especially as women, especially women who are doctors, who had to briefly be patients, whether it's through maternity or some other unfortunate event, we all kind of got a little bit of taste of what it's like on the other side, and it's very very important because I know how to advocate for myself because I know what should happen in a hospital. I know what should happen in a timely manner, what sort of workup I need to have. But if I didn't have this information, I might be in a really bad situation. I might have given birth in my car, So always, if you don't feel right, something is wrong, you feel off, just stand up for yourself, ask for help, ask for a workup, find a doctor that's going to talk to you and listen to you. And if they just can't listen to you or they're not willing to, you can find someone else. I'll say, don't give up, and we can get you feeling better.
That's what's being a strong woman is all about.
Yeah.
Well, you just heard how important strength, muscle, and lifestyle are for long-term health and how doctors like Dr. Kate are actually prescribing those things. If you're ready to have the fitness side supported too, come try our 4-week trial at W3 Body. Semi-private strength training, team cardio core sessions, and a community of women who are working on their lifelong health right along with you. Dr. Kate, it was a pleasure having you on. Thank you for
Same.
sharing
Thank you
all of
so
your
much.
knowledge. Absolutely. See you next time on Real Women, Real Results.
Bye-bye.
Thanks for tuning in to Real Women, Real Results. If you loved this episode, be sure to follow the podcast and leave a review. It helps more women find these powerful stories. If you're local and want to join our gym, check out our 4-week trial. Head to train@w3body.com for more info. And don't forget to follow us on Instagram, w3body_Berwyn and w3body_Elmhurst for more strength, support, and community. See you next time.